Today I'm gonna talk to you about lip lift surgery. The lip lift is a technique where plastic surgeons shorten the upper lip distance and make the lip shorter. That operation has different techniques and different designs. However, the aim of this surgery is to shorten the distance between what we call the supination and the lip. There are three things that lip lift can achieve. Apart from the shortening of the lip, which creates a more youthful appearance of the mouth, it tilts the red part of the lip upwards and gives the appearance of fuller lips in a natural way, both in the front but also in the side view. The third thing it achieves is more teeth show on smiling, something that is a very attractive feature. Lip lift surgery usually is performed under local anesthesia. The length of the operation is usually half an hour. It requires small stitches under the nose, which we remove approximately after a week. Let's talk about what are the signs of aging lip. Mainly, we get thinning due to the loss of adipose tissue fat, also lengthening of the lip, so we know that as we age the upper lip becomes longer, and also there's some skin surface damage due to the sun exposure, movement and the muscle action. So the lip lift will shorten the upper lip, and because of that it will reverse some of these aging signs. Is very powerful, and it depends on the design that the surgeon chooses in order to achieve a certain result. For example, when we have an asymmetry, when one side of the lip is longer, we can decide to remove more skin on that side to improve asymmetry. Of course, there are some limitations, and as we know, there is no perfect symmetry in real life. However, the upper lip lift is a powerful operation that can improve to a big extent these asymmetries. This is a very important point. The lip lift, as it extends from the middle to the side, loses its ability to lift the lip up. So it has some effect on the corners of the lip, however, it's not as powerful as it is in the middle part. So it's important to understand that, because the results can be limited in the corner of the lip. And also it's important to understand how your surgeon will design this operation. For example, we can design this as a bullhorn excision, which means that the central part of the excision is much smaller, but the side is bigger. In that way, we can have more effect on the corners of the lip, and we can achieve a more harmonious result. The best candidates for lip lift are people who have elongated upper lip, people who, when they smile, they don't show teeth, and people who want to have fuller lips but without the unnatural look that sometimes fillers can show. So people who understand this procedure will see that the effect of a shorter upper lip is a more youthful appearance. I see that in a lot of my patients, where the effect is not just limited in the perioral area, but it has an effect on the whole face. There are some techniques that create an upper lip lift through an intraoral incision. It's not one of my favorite procedures because the effect of lifting is very limited. I believe the art of upper lip lift is to design the scar in the natural crease of each person's limit between the nose and the upper lip. In that way, the scar does not appear to be a scar, but rather a fold or a natural crease. And this is the camouflage trick that makes a scar not visible. The difference between a lip lift and lip fillers is that fillers are injectables that usually are made of hyaluronic acid that we use in different parts of the upper lip in order to give volume or to eliminate wrinkles. So they're two different things and they are complementary to each other. Sometimes I like to combine both procedures in order to get the best results. One of the advantages of the lip lift is that it minimizes the need for lip fillers. A lot of people who will have this procedure will not need lip fillers anymore, or will need very small amounts to get the right results. Depending on the elasticity of the skin of each person, we might see a small relaxation of the upper lip after a few months from surgery. Usually this is very little and it's not an important extent of skin. However, there are exceptions to every rule, and there are people with a lot of elasticity where the drop can be significant and it may require a second operation in order